Senator Alsobrooks.
Good morning. Thank you so much, Mr. Chair, and thank you so much as well to all of our witnesses. I agree mostly with what Senator Kane says, except I do not agree that I'm so happy to have a hearing after we were up until 2:30 last night. I don't know about that concept. Thank you as well to our ranking member for hosting today's hearing. I just want to say at the top that I really do fully support the concept of unlocking benefits and the promise of the American dream for all workers. I also agree with the concept that the way that we work is changing, and that we have to really leave room for that, that the way that people want to work is changing. The thing I disagree with is what is preventing workers from achieving the dream. So just in the past few months, we've seen this administration take repeated and unprecedented steps to attack the American worker and undermine federal worker protections. We've seen the firing, for example, of tens of thousands of federal workers who are my constituents without cause. We've seen the steamrolling of civil servant protections clearly in statute, and we've also seen the issuing of executive orders that eliminate collective bargaining rights across federal agencies. We've seen the gutting and politicizing of the Merit Systems Protection Board, the NLRB, and the EEOC. And so this administration has targeted collective bargaining agreements and agencies that afford workers due process. So today, this committee, I believe, is considering legislation that would yet again undermine the American worker. So, Mr. Driscoll, I have a question for you. The Senate just voted on a bill a few weeks ago that would kick millions of Americans off of their health insurance and increase costs for families. And now we're discussing a bill that would, I think, further erode patient protections and increase health care costs. So can you just talk about unions again and help to educate the public about the way the unions every day work to fight for real health benefits and lower health care costs for their members and their families?
Yeah, thank you for the question, Senator Alsobrooks. Yeah, the reconciliation bill is going to have devastating effects at the state level. As Senator Kane just referred to, the support for state exchanges, which are critical not just for workers, but for independent contractors to access health care, is going to be devastated. And in turn, those uninsured patients, because they will show up somewhere, they may not get their regular checkup, but they'll show up at the emergency room. And there's a bill to pay, and healthcare providers can't be doing that for free. They're going to look to other people with pockets, and that's going to be the insured plans that unions and their employers jointly designed to take care of that. So yeah, we're going to bear the burden of that cost.
And as you've mentioned, just kind of further building on that, the rising uncompensated care cost is something that's going to be really devastating to the whole system, and that, as well as the Republican reconciliation bill, will actually increase costs for working families with employment-based coverage. And can you just talk a bit more about how that costs? Because the whole theme is here that we are increasing costs for working people.
Correct. I note that the large agreement here today is the rising cost of health care and how pressing that is on families. And how we address that, I think we can agree on as a principle we should be getting. What we actually do to arrive at that is going to be the key difference. Expansion of plans that don't provide for employee input, the actual beneficiaries, fiduciary obligations. Union health plans actually have employee input into their design. That doesn't exist with some of these other health plans that are out there. I think we need to be careful in advancing a principle that at the same time should always preserve do no harm to the existing systems, and that's my concern with what this legislation could do.
And finally, with the last few seconds that I have, today's hearing is framed around benefits, but I think it's impossible to separate the conversation from the Trump administration's broader anti-worker agenda. And so I just want to ask you how the attacks on federal workers, because I don't think we can ever forget the way that our federal workers have been demonized. These are patriots. They are my constituents, many of whom have worked for decades under both Republican and Democratic. They don't care who the president is. They just work for the people. But how do those attacks and collective bargaining agreement threaten really all workers?
Yeah, I couldn't agree more. These are public servants who've dedicated their lives to providing vital services. And if collective bargaining can be wiped out at the stroke of a pen or an executive action in the federal sector, I have every reason to believe that the same effort could happen for collective bargaining agreements for workers across this country.
Thank you. Thank you so much, Mr. Chair and Mr. Ranking Member.
Hickenlooper just got in because they couldn't find my end of hearing notes. So, what impeccable timing.